Are you still trying to stretch your IT band with foam roller or yoga poses, but not feeling any relief? In fact, you may actually notice that your pain seems to get worse after you finish doing your yoga or stretching with the foam roller. Today, I'm going to show you why that's not working and what you can do instead. First off, let me say, I understand that this is a controversial video. There are many people out there on the tubes of you who assume that you can stretch your IT band and will give you 5 million ways to do it. Before you comment about this video, please watch it until the end so you can at least understand what I'm talking about here. And then also consider this question. If you have been foam rolling your IT band or doing yoga poses to help your IT band and continue to suffer with IT band pain, then let me ask you to consider if this is actually working for you. However, if you are someone who's been foam rolling your IT band and been frustrated because that's the only information you can find on YouTube, then let me tell you, you are in the right place because I'm going to give you other ideas that you can do instead. I'm Dr. Amy, PhD trained in orthopedic manual physical therapy, and I believe that movement is life and you deserve both. First off, we're going to discuss what the IT band is and why it feels tight in the first place, which will lead us to why IT band stretching doesn't actually work, what's really causing the problem, which will naturally lead to what you should be doing instead. Okay, let's discuss what is the IT band in the first place. So the IT band is a thick piece of fascia that has its own special name. Now, fascia we have from the top of our head to the tip of our toes. We have it all throughout our body. It helps hold our organs in place in our abdominal cavity, and it's a very important part of our body. When there's a thickened piece of fascia, it gets a special name. So think of the IT band in this case, or the plantar fascia. You may have heard of plantar fasciitis. That's an irritation of the plantar fascia, which is a thickened piece of fascia that has its own special name. If you're not familiar with fascia, if you think about a raw steak and you're trying to tear the fat off of the meaty part, and there's that thick, white, stringy stuff in the middle that makes it really difficult to tear it off, that, my friend, is fascia. So this IT band, or this thick piece of fascia, gets tight and people feel like they need to stretch it in order to get it to loosen up. However, there's two important facts here. One, fascia doesn't stretch, and two, fascia doesn't like it when you try to stretch it, because what happens is it will create microtrauma, which will actually lead to more sensation of tension. Again, I get that this is all controversial and this is not what everybody's saying. However, if what you're doing is currently working, you're probably not going to be watching this video in the first place. So stick with me and hear it out. Okay, why stretching the IT band doesn't work in the first place? Well, because the IT band is made up of fascia and it's not a muscle. So muscles have muscle fibers and they contract and they relax. They contract and they relax. So when you stretch, it helps to relax the muscle fibers. Well, fascia does not have that contractile unit. So when you try to stretch it, it's basically causing a tearing because it can't actually loosen. It just creates micro tears to try to make you happy and feel like something happened, which is why it might feel better in the short term, is because you're like, oh, okay, something happened over there. However, in the long term, the body has to now repair those micro tears, which leads to more of a sensation of inflammation or tension. Aggressive foam rolling can also lead to increased inflammation, which means it will feel good maybe in the short term. Okay, I know it doesn't feel good while you're doing it, but it feels good right after you're doing it because you get more blood flow into that area because it caused inflammation. However, it's not a good inflammation, and so it's not actually going to help heal the area. So when you have pain or tightness in the IT band, or even it may be on the outside of your knee, because that's where the IT band inserts into, chances are good that it's because of a muscle imbalance and not actually because of a tension issue in the IT band. Which leads to our next discussion, which is what is really causing this problem. So to discuss that, we need to discuss where the IT band originates from. So the IT band originates from a group of muscles that are up in your hip. So if you put your hand on your hip, you're actually putting your hand on all those muscles that attach into that IT band. Now, when those muscles are not functioning correctly, it causes the IT band to become tight to try to compensate for the muscles. Now, that doesn't actually work. It just causes pain and tension and makes you feel uncomfortable. However, the body's doing the best it can. Most commonly in the clinic, what I see is a weak gluteus medius. So your gluteus medius is the muscle that kicks your leg out to the side. It's called the hip abductor. And when it gets weak, you may have difficulty kicking your leg out to the side. The other thing you may notice is that when you walk, your pelvis is not able to stay stable. So you walk like that model, walking on that catwalk because your hips are dropping, but that's actually not good for you, and it definitely can cause problems in your low back. So we need to fix that. Sorry, your modeling career may not take off the way you intended. Now, another muscle that attaches into the IT band that can often be a problem is a muscle that's more in the front of the hip. So again, you put your hand on your hip, you're putting it right on your gluteus medius, and your fingertips, if you squeeze your fingertips a little bit, your TFL is going to be underneath that, the tensor fascia lata. That muscle helps to actually bring your knee to your chest. So it's actually one of the hip flexors. And so it gets really tight when there's a muscle imbalance in your hip, most commonly due to weak glutes. So if the muscles in the back of your hip, so now you're going to put your hand on your behind, those muscles back there, if they're weak or tight or just not activating properly for some reason, chances are good that your TFL along with your psoas, which is another hip flexor muscle, are going to become tight. And when they become tight, now, this is a muscle we're talking about, right? So they become tight, they become functionally weak. So you may feel like, oh, my hip flexors, when I try to bring my knee to my chest, it's really weak. And it may be authentically weak. However, it may also be functionally weak in that it's stuck together. So it's stuck in that contracted position and it cannot relax, which means it has a mechanical disadvantage. And the last thing, which I don't want to overlook, is that you may have a pelvic malalignment issue. So your pelvis, when you put your hands on your hips, your hands may not be at the same height. And the problem with that is that causes all of these other things that we were just talking about to become an even bigger problem. And most of the time, when I have people come in who have an IT band tension issue, they have a weak glute maximus, they have a tight TFL, they have a tight psoas, and they have a pelvic malalignment. So it doesn't have to be one. Often these guys can all occur together. But the reason why I want to point out that pelvic malalignment is that if that's you and your hips are not at the same height, what will happen is if you try these exercises and stretches that we're going to discuss next, you'll find that it maybe aggravates the problem, but it definitely does not solve your problem. So if you do the stretches and the exercises that we're going to be talking about next, and they're not benefiting you or even making things worse, please make sure you see a manual physical therapist who can address any underlying issues that you have that are leading to this malalignment issue or this lack of strength issue, which is showing up as an IT band issue, but it's not really the root of your problem. Okay, so if you're not supposed to be doing yoga poses and you're not supposed to be doing foam roll stretching, then what are you supposed to be doing? Well, of course, we want to deal with the root of the problem. So it's identifying which of these issues is bothering you and dealing with that. All right, so if we have a tight gluteus medius, so gluteus medius is right here. Remember when I was saying put your hand on your hip? So if you put your hand on your hip, your gluteus medius is here, your TFL is up in here. All right, that's your hand on your hip. So if your gluteus medius is weak, there's things that you can do to strengthen that. Now remember, the first thing we talked about is the fact that the gluteus medius kicks out to the side. So this is something you can do to strengthen your gluteus medius. Now, if you feel like doing it in standing is not enough work for you, then you can lay down on your side and you can kick your leg up to the side, and then you'll be doing it against gravity. Usually I recommend doing 2 sets of 20 on each side. If you can do that with ease, then go ahead and lay on your side so that you can do it that way and get gravity to be giving you a little bit more resistance. But if it's tight, what you need to do is stretch it. Now, this will not actually stretch into the IT band, although you may feel it into the IT band. You may feel it stretching down there. Our goal is to stretch the gluteus medius up here. So what you're going to do is you're going to cross one leg over the other. And I like to hold on to something just for a little bit of balance because why not? And then you're going to stick your hip out to the side. Now, when I do this, I can feel it stretching from here, probably down to here. Sometimes when my IT band is really tight, I can feel this all the way down to my knee, but I'm not trying to stretch the IT band. Got it? You need to feel that stretch up in here. Now, for some people, they're a little bit more flexible up in here, so you may need to stick it out more. Okay, now for me, I get a lot of that into the IT band, which is not what I want. So I would want to stay up in this region up in here. This is a better stretch for me, but just know you can go deeper if you need to. Now, I will be honest, for some people, I have them just cross one foot over and they just go boink and stick that hip out to the side a little bit. And they're like, I feel it. It's like, that's a massive stretch right there. Again, do what feels like a good stretch for your body, not a painful, I have to hold my breath because it hurts so much stretch. Got it? It's important to do the right stretch for your body. You want to hold it for 10 seconds, then you can switch over and you can do the other side. Stick those hips out to the side. Again, see, different from side to side. So when I come to this side, I'm getting a little bit more resistance. This IT band is a little bit tighter. So I'm getting a little bit more resistance, a little bit harder to get into that position, but there we go. Okay, now I feel it up in here and not so much down in there. But again, you may have to kind of work around with it. Every body's a little bit different. So make sure you find that stretch that works for your body. 10 seconds to each side, 3 times. Okay, but you may be saying to yourself, Dr. Amy, it's not so much my gluteus medius that feels tight, it's that TFL, rectus femoris, psoas, it's these guys in the front. That's a bigger problem. Then for you, what I am going to have you do is I'm going to have you, again, hold on, so you've got some balance. You're going to grab your foot, bring your knees close together, and then what you're going to start to do, so you're thinking, oh, this is a quad stretch, and it is a quad stretch like this. However, if we push this knee back behind the other knee, it becomes a psoas, rectus, TFL, all these guys in the front get stretched as well. So if you feel like your IT band tightness is coming more from tension up in here, that's going to be the stretch for you. You're going to hold it for 10 seconds. I would still do both sides, even if you only have a tight IT band on one side right now. Why not do both? And I would do 3 sets of that. Okay, now if you're like, Dr. Amy, it's my glutes that are tight and that's the problem, then I'd recommend the figure 4 stretch for you. For that, you're going to be laying on the ground. You're going to put one foot on top of one knee. And then for some people, that's enough of a stretch. If that's you, go ahead and hang out here for 10 seconds. If that's not you, you can push this knee away. And that may be enough of a stretch for you. If that's you, hang out here for 10 seconds. If not, and you need to ramp it up a little bit, then you can go ahead and bring this knee to your chest. And that should be a really, really good stretch for you. If that's still not enough of a stretch for you, and you feel like you need a little bit more, if you move your foot up or down, it changes how you feel the stretch in your hip. Now, I don't recommend moving it up and down. I recommend finding that spot like, okay, that's a good stretch for me, and holding that for 10 seconds. And then I would go ahead and do that on the other side as well. And you may find that each side is different where you feel like you need that good stretch, and that's fine. Do what feels best for each side to get the stretch you need. You'll hold this stretch for 10 seconds on each side and do 3 reps. Now, if you're like, well, Dr. Amy, my glutes are not tight. They are weak. Then I got one for you guys. What you're going to do is you're going to do butt squeezes. So you're going to squeeze those cheeks together. Hold on. I got to focus on this one. There we go. You're going to hold for 10 seconds, and then you're going to relax. So you're trying to do 10 reps with 10-second holds to get those glutes really squeezing. Now, here's why I really need to pay attention when I'm doing that, is because we don't want to be activating the hamstrings. Well, hold on. Let me change that. We do have to activate the hamstrings because they're going to work together, but you can do it with your hamstrings or you can do it with your glutes, and we want to be focusing on the glutes. Let me see if I can show you what that looks like. So if I'm doing it with my glutes, I'm going to squeeze my glutes together, and you'll see more of that coming through here. Now, if I do more through the hamstrings, then it becomes more here. And so I get more of this tilt here, and I know it's a small motion. I do apologize. I realize it's hard to see on video. But when I get my hamstrings involved, I have more of this. Whereas when I get my glutes involved, there's less of that. Okay, so there's less of this tilting happening in here. So you want to be squeezing those glutes and not as much the hamstrings. Now, the hamstrings do contract, but not focusing on those. Holding it for 10 seconds, 10 reps of those. Now, if you're like, okay, I can do that, and that doesn't feel like enough of a challenge, then it's time to ramp it up and to do some bridges. If you're gonna do that, you're gonna squeeze those glutes first, and then you're gonna lift up. Make sure you keep those glutes squeezed so you're getting that work coming through here. And then slowly resting back down, keeping that glutes engaged while you come all the way back down so you don't have that low back taking too much of the stress. If you're going to be doing bridges, I want to make sure you do them very, very carefully, making sure that you're focusing on the glute activation. What I'll often see is people will do bridges and they'll just kind of be going up like that, and it's like, well, you're not really getting that glute activation very well, and you're putting a lot of torque through your low back. So glute activation all the way up, glute activation all the way down. Who is this particularly important for? If you are a very active person, if you like to do yoga, if you like to run, if you like to cycle, you're regularly involved in team sports, or you're just someone whose IT band gets aggravated no matter what you do, you're going to want to implement the exercises and stretches in this video that are most effective for you. And if you watched all the way this far and you're still skeptical about if these will work instead of foam rolling, I'm going to ask you to try it out. Give it a 1-month trial. Find the stretches and exercises that are working for your body. I understand every body is different. Find the ones that work for your body. Don't foam roll for a month. Do these exercises for a month. And try it for yourself and see if that helps decrease your IT band tension. But the one thing I can tell you is that if you've been foam rolling for days, months, or years and not found any relief, then that clearly is not the tool that's working for you. So stop trying to stretch what doesn't want to be stretched. I look forward to hearing your stories about how you are a former foam roller as opposed to a current foam roller when you're trying to treat your IT band. Now, if you're someone who has that knee pain on the outside of your knee when you are trying to climb upstairs, I'm going to have you check out this video over here. Please give this video a thumbs up and don't forget to click subscribe.